You stayed at the Athra resort under the care of Dr. Jayalakshmi and Dr. Girish, I thought let me take responsibility of making some awareness of the Ayurvedic therapies, how they act on the body and what you can expect. A few clinical evidences that comes in our normal routine practice in the clinic that will help you to relate how these therapies are acting on the body and maybe at a certain other level also. And I think it's easy to start with a very common condition that we face these days, which is a disc herniation or a disc prolapse or disc extrusion or bulging, whichever way you call it, like a slip disc, is such a common entity for a very common clinical feature called the low back ache. And of course, the neck ache also pretty common. So we will start with a look into how a normal spine would look like, and this area will be focused now in the camera so that you have a feel. This is how it looks like from the side and how it would look like from the straight anterior to posterior, and this is the lateral. So this is how in the focus here. This is how it looks like, and just to look into the vertebrae and the disc, the blue one here is the disc, and of course this will slip and get into this area, and this is like a sponge effect. And as you can see more better, this is the best labeling. And here you have, if I halt it, I think it is better that I get the this may be a better look. I'll make it a play, and here I should halt it at this point because this is the disc that will hit here and pinch the nerve, and then the pain will go down the leg or the hand according to the side. But this is a much more easy way to realize how it looks like a disc, that like a shock absorber effect. This is the blue is a disc, and if you can focus in this area. But this is just to showcase to you how a disc would look like. And when we deal with a situation like low back ache with a herniated disc, and this is the area to be focused, the cursor, and you can see the disc getting spread or the ejected, or I won't say oozing, but the slip, and that causes the pinchial nerve and the pain down the line. And of course there are other conditions that can cause similar, but anyway we are dealing with only the herniated disc as of now. This is also another condition, but anyway we are here to realize that we need to have a realistic feel of this is a different slide. I will just prefer the top one. Yeah, here is the disc herniation of somebody who was 51 somewhere in 2008 at the beginning stages of this resort, and this lady had no other option, either do Ayurveda and give a shot to Ayurveda or go for surgery, which she was not physically fit for. And if you can see in her, there is a big prolapse here, very clear enough, and you can see the blackish disc, we call the degenerative disc disease with intervertebral disc prolapse. And here there are some white spots that would signify the hydration aspect, that is opposite of degeneration of the disc. And if you go like this further, as you can see that this is in 2008, and here is the disc herniation, the focus here. This area is the action, and this is a different one. And here, if this cursor is a white normal, this is the abnormal. This is the L4, L5 level. But just to tell you, she was here for 3 weeks and she did all the panchakarmas that were suitable to her, the enema, the vasti being the most important for her. But of course there are other therapies like Dhanya Mladhara, the enema being done, the what we call as the Kati Vasti, where you make an oil tank, being stagnant at a certain level of the vertebra wherever the action is required, and such therapies. And she had a scenario of going back after 3 weeks of therapies, and after 3 years, of course, we do find the changes happening in the disc correction happening after close to 16 months from the completion of therapies. But having said that, it is not a must. There are many patients who have the same status of the MRI before Ayurvedic treatment and even after. The condition in an MRI reading or the MRI plate would be the same structurally speaking, but the patient is totally happy, totally symptom free and absolutely healthy. So we would never consider health to be verified only by an objective finding. We would prefer the idea of subjective finding also, which is what happened in her case, subjective as well as objective proof. And if you see the cursor here, and I think I will make it easy for you to zero into this area, that the disc has receded back, and also you can see there's more hydration. I'm not sure if there's any kind of technological or technical aspects to make it brighter looking, but anyway, the patient was symptom free after close to 6 months of the therapy's completion here. And then if you see, she's 54 at that point, and to make it much more easy for you to relate, this is how it is normalized. And you can see this is a normal here, and it's 18th of October 2008 compared to what it was in 2005, 20th of July 2005. So as I mentioned, that we may find these changes happening even after 16 months, but it's not a must. And here you can see it has receded enough. This has gone back compared to this normal side which was before also, and has gone back compared to what I would describe as this black encroachment here, and this was normal anyway previously too. So this is a very simple indication, and here you see it has gone back. This has gone back. This slide was primarily meant to convey that it is possible in Ayurveda to make structural corrections of surgical nature in a medical way with full-blown panchakarma therapies in good majority of conditions which are usually meant as not very sufficiently or encouragingly managed in some other system of medicine. As I said repeatedly in the previous presentations also, I don't mean any offense to any system of medicine, but then it is just to showcase the strength of Ayurveda, and it's for anybody to choose which they prefer. So this is one case that I would conclude by telling the message to have a structural correction in a medical way possible by doing full-blown therapies of Ayurveda. And the same measure I would prefer to make sure that we showcase another case where the structural correction happens as a ripple effect. This is a lady who had, somewhere from Europe she had a condition called the morbus pagid. It's like a cancerous eczema of the breast tissue area, and this is how her photo was in 2006. It can be focused here, and this is how her skin looked like in the breast area. And I never promised her any kind of cure for her condition. I said you will have a simple detox, a simple rejuvenation as we call it, and we will try to heal the system in general than only local effect. And this is how it was in 2007, and none of this I saw before she came or when she was here. All these things I see only after 3 months of completion of therapies here. But just to have a look, this is how it looked like in 2008, as you can see here. But let me make sure that I highlight it once again for you. This is how it looked like for her in 2006, and you can see this area. I'll now focus here. And this is how it was in 2007, and of course she deserves to be mentioned that she had her own share of depression and other mind issues which always precipitates the skin conditions, because the ectoderm is the one that gives to the skin and that gives to the brain also in our embryology. So the brain and mind is so much connected to the skin health, obviously. And this is how it was in 2008, as you can see here. And in 2009, when she came to us on the day of arrival, was the period like Jan 16 to February 6. So this white portion, if I put my finger here and make sure if this white portion is a steatatreya, this is the treatment duration, and you can see the change in her after about 10 days of the completion of therapies, that is 2009, somewhere in February 16. There is a clear change from this shade here to this shade, which I never knew because I did not bother to examine it, because I had offered no much promises to her And of course she was reporting me that she is feeling fine, and she was, since she had a traumatized mind anyway and it was so sensitive part of the body, we would never keep bothering her with inspection. But anyway, the Ayurvedic treatment happened was from January 16th to February 6, 2009. It's more than 5 years now. But what was the good thing to be realized later, if you could please keep this in your mind as before Ayurveda at Atreya, and it's like during the process, the white screen, and then this is after the Atreya program of cure was done for her. She did send me an email. That is when this whole attachment came in one shot, in one slide, to have a picture like this in April 2009. And you can see that this and these are, if not exactly the same, but they have improved very much here. So this of course is a normal, and this has made a very significant change to her. So I think it is now important for her, isn't it full light, Karnataka? It's very important now for us to compare this one. I will just lower it a bit more, from this to this to this, which is nearly equal. Of course you'll have it in the PowerPoint uploaded. It's nearly equal situation. But anyway, she did find profound relief by the therapies here. The message is not that. Here we could make a structural correction in a medical way without any localized applications only. But more importantly, the message here is that there is a ripple effect of these therapies that keeps happening in the body. And that is the beauty in Ayurveda, that whatever benefits you may get during the therapies is just a bonus. The real benefits are creeping in, or they are coming like a ripple effect further and further if you are able to substantiate the cure program by follow-up medicaments at home or follow-up miniature form of therapies at home. This was a message from this slide, that the ripple effect of the therapies. And the important point here is that she had tried her best in Europe and elsewhere in other continents also for her medical care regarding this, but we are happy and feel honored that it was a system in India of Ayurveda that helped her to achieve this result, and which was sustained for the next 3 years, till which I was in contact with her. So it lasted at least for 3 years, the effect. So in these two slides we had a scenario where the person at least had stayed here in our place, and it was a scenario where we had full-blown therapies of Ayurveda done. But these are my people in the government service. I do come across people who are, I would not offend their economic status, but who are so-called economically poor. And these are the patients who do not even earn sometimes more than 300 rupees a day, which is hardly 5 US a day, not even that. And these are the people we come across. One example out of the many hundreds we come across who are the so-called economically downtrodden, which simply means, as I don't intend any kind of economical offense on the status of economy, is that our resources are limited. We cannot always ask them to stay in the IPD or hospital, and we have limitations of giving them medicines for more than 2 to 3 days time. So basically there are resources against us, and it's the crunch of resources also on most occasions, which makes it very important that we have to get the best for our benefit of the patients in the available resources. It's just unbelievable that even in these times and years, in the most literate district of Indian nation, the most literate district, more than 95 to 98% literacy, we do have people like him who come. That's a clear reminder that not everybody is rich even in this district, which means they can't afford the best of medical health care all the time from private sources. They depend on the government services heavily. So this is one example to show a lady who has a complaint of varicose vein that is so engorged, as you can see it here very much. And in her case I could not do the bloodletting therapy because her hemoglobin was very less. I could not do full-blown panchakarmas because she cannot afford to stay in the hospital. All that we could do was provide her, as you can see the skin, focus it on the neck, is that the messed up scenario, the pain she had, the oozing she had, and of course, as you can see, the skin was not looking great anyway. She had a scenario of, I'm just rushing through it, this much engorged veins, and they are like coolie class people who would stand and work, and she had her own share of problems with the work and the money, and all that we could provide her was a specific powder in Ayurveda that is used in multiple ways. It has close to about 33 indications easily, and it was given to her to made as decoction at home, and she would rinse like a herbal water rinsing the area, and she would wash the area, and as you can see the changes that are happening to the skin, and of course the website would have it very much more clearly and you have more time, and you can see the new skin forming here and the old skin getting peeled off. So this is how the changes are happening. It took more than 45 days for every day the changes to happen slowly as she went on doing only I stress only local dhara or local rinsing of the herbal water that she would make at home, which was provided as a powder from the government dispensary where I worked almost 5 years ago. So this is the area how it was improving, and we reached a stage where the new and the old skin are together, and this is nearly unbelievable how the varicose vein got shrunk, and of course also this finishing nearly fine, but the varicose vein is enormously shrunk. So what I meant here was that, and she's nearly healed, but there's still something left out, but at least as you can see the new skin. What I meant out of this slide was that it is possible to make structural correction in a medical way in Ayurveda by doing only even local therapy, as happened in her case. So it is possible to make these changes sometimes even with local therapy without an IPD staying in a hospital or elsewhere. So the last three slides were like this. The first one was the structural correction in a medical way by full-blown therapies. The second was the ripple effect the therapy is made even without a local application but systemic application of the procedures as seen in the morbus Paget case. And this third one is a local therapy only making the structural correction and of course the symptomatic relief. And now we will get into somebody who has optic glioma, of course a tumorous condition, and this child had problems of closing the eyes, obviously seen. And I would just request to focus this area as the camera would show you much more clearly that this left eye is normal, of course, the right eye where the tumor is pushing the eyeball, and this big it was. So he cannot go to social functions, he has to keep one of his eyes closed. The flies would come, the eye would get dry, and he was not fit at that point. It's more than 5 years ago. At that point to either go for a radiation or a chemotherapy is just to wait and watch. And it is when he came to my master, Dr. Sahadevan sir, and he treated him, and I was implementing therapies as far as I could as his representative. And we did find a situation that we could not make any local therapy. We could not make any panchakarma. Of course, he's not fit for it, it's just age 4. And the only option we had was to give him what we would call as internal medicament. And as the days and the weeks progressed, close to after 2 to 3 months time, we reached a stage where the eye of the right side is nearly closing full length as the left, but it was not fully closed. At least we reached a scenario that we could make maybe millimeter kind of change inside, making him making him a scenario of what I would call as some shrinkage in the tumor size to prevent an extra push of the eyeball. And if I just go behind, this is just a purely OPD level therapy, and from this if we focus to the point of this much of the aperture open, I think this is focus dial, to the point of, if you rush through it, even if it took more than 2.5 to 3 months of being nearly able to close. Of course, we did not cure. It did not mean the tumor vanished or disappeared by any means, but then we could offer a quality of life for not more than rupees 1000 a month, which would be less than 20 USD a month. For somebody who could not be done radiation or chemotherapy, even surgery was not easy, and the complications, possibilities with anesthesia, etc. So the message of this slide is very easy, that it is possible to make a surgical correction in a medical way even with the internal usage of medicaments, and need not be only a localized therapy also. In all these cases, at least we had a scenario where we will come to this later, a scenario of what I would call as some form of involvement of the patient by all means, because the patient was alive and the patient was awake. But in this case now, as we would realize it, it's a case of coma, and I would attribute this copyright to the technical knowledge of my master and my mentor, Dr. Sadhyan sir. This is contact detail. And this is a case of what we would call coma of somebody. The videos were close to about 1.5 hours, which we compressed and made it to close to 19 minutes, and now we will finish in the next 2 to 3 minutes time. So in this case, it is the we will put the sound on, off here, yes. We will put the sound on now. This gentleman was rejected from the regional cancer center with all respect to his condition. He is a case of recurrent astrocytoma. It's a cancer, of course, and he had a scenario of what I would say that the Glasgow scale was 3, the minimum for any coma scale, and we had a situation that he was not even blinking, of course. And this is shot in a slum area. I think I'll reduce the sound. And the peculiarity was that he was written off from the regional cancer center, and he was in a slum area. His educations were not very great. He was poor economically, and we volunteered to focus for his cure by offering complimentary free medicines, and in return we received the permission to shoot his condition and to document it and to share with other doctors and junior doctors also. So he was being monitored by the regional cancer center doctors very sincerely, even if he was outside. I mean, in terms of the fact, not that they were coming and meeting, but somebody of them they knew would come and realize his status of improvement firsthand. So somebody they had perhaps delegated. Anyway, he had a situation of, and of course you will see the video properly enough if you like to later. He had a situation of a bed sore, and if you compare it from this point, like he was not even blinking at one point when we started with him. He was not even blinking. This is the Riles tube, as you will see here, and as you will see that we are going forward and forward, and here I make the commentary on that. And we reach a stage, if I halt it here within a focus here, that he could be got rid of the Riles tube. And in this case, he is of course not conscious. He has no clue what he is going through. We are not doing any kind of panchakarma. We are not doing any kind of internal drinking of medicines. Whatever goes through is through the Riles tube, which is of course limited. And we are applying medicines to the eyes as a stimulant if we can arouse his coma situation. And here you can see that he's totally out of the Riles tube. But we still go forward enough to see what is being done. And this, if I close it here, like this big was, it doesn't focus here, this big was his tumor, the recurrent astrocytoma. This is a brain tumor, of course, variety. And then here, of course, you see it's not a straight midline, this is a midline shift. So this was the scan, the CT scan we had, which itself never made things easier. And this peak was a tumor. But anyways, he is in coma, and that's what. And then he got a stage where he is out of the. You can see his claw hands, and this was the slough and the non-healing ulcer he had. And I made sure that I made the video of the same, and of course you will freeze it at a certain point here, that this I would freeze so that we can focus. So this is the area to be focused, that it's a slum area, it's a rainy season, he's not having full-blown medicine, full-fledged, there's no panchakarma that is possible on him, his immunity is compromised, his nutrition is compromised, everything's against us, and it's a slum area. So, and he's carrying such a bed sore. But as you see later and later, as he was on therapies further, and I'll just go through it, that he started to make some blinking. There were some movements that were happening. I was doing one point there, and this was a slum area where we were going as a complex. And of course, the video will be later shown. We'll just rush through it. And now you can see him blinking from a point of no blink. He started blinking. His Glasgow scale did improve from 3 minimum to 7, 8, even up to 9. The details of which you will find as a printout in the uploaded scanned copy, and we could see the blink very clear enough. ಅದು ಫೋಕಸ್ ಅಲ್ಲ ಲೋ ಲೈಟ್ ಲೈಟ್ ಅಲ್ಲ because we are already shooting it in a slum area in the rainy season. The video origin itself doesn't have much of light, but anyway, you can see him. There's a blink clear enough, and here is the shot. A wound that was so big and so messed up, it has so much reduced in extremely odd and unfavorable conditions of medical, social and financial nature when it comes to Said Ali. And if you can see, there's a healing tissue here that is getting formed, and this is like really getting the healing slowly and slowly, step by step. And if I just rush through a bit of it, of course he did expire, and as I mentioned in that, what I meant was that the gentleman who was in such odds, he had a scenario of what I would describe as the hopeless condition. Everything against him: finances, medical situation, socially his wife abandoned him and took away the only child he had, and a slum area, monsoon season, immunity compromised, nutrition nearly nil, medicines not being totally implemented, and he could not use his mind, of course, to impart his own healing as the other cases would have been done. Even in such messed up cases, the body has the capacity to bounce back if given the right kind of medical support, which Ayurveda does. And of course, that was a clear proof in his death that he did not go through oxygen cylinders. There was no extreme palliative measures needed. At a cost of less than 800 rupees a month, less than 15 euros or so, we could give him a decent farewell, a clean death, a peaceful death, a painless death, without any implications of economic nature that would have easily crossed more than 100,000 rupees or maybe even 200,000 rupees that we could save for him, and the process ensured that he had a very peaceful death. I did have the honor to be invited to the function after his death, because we were very feeling responsible for his welfare, and his family was so cooperative, allow us perhaps the only available video of coma being treated by Ayurveda. And I owe this very much to Dr. Sadevan sir, my mentor, to my another mentor, Vaidyan Sri Manmadan Vaidya in the forest area, because the medicines used in this were also for snake bite cases of coma. So it was a mixture of, and also Sri Trilok Dopeshwar sir, Vaidya Trilok Dopeshwar sir in Pune, who helped me with the procurement of the Hemagarbha Potli. So it was a mixture of opinions of different specialists inside and outside Kerala, and we could make up this documentation. So the message is very clear here. If such messed up health people can get so much of improvement in the quality of their body tissues without any involvement of the mind, it is definitely possible for normal people like you to feel enhanced tissue quality further and further. And before I conclude at these levels of the physical correction, I would also prefer to communicate that there are situations where, so far I have been talking with you about the frame of the physical domain of the healing, but there are situations where we have to believe in the non-physical domain, where I would be forced to use terminologies of energy healing, of past life regression healing, by making past life regression, and such therapies of the words like Reiki, like pranic healing, or spiritual healing, or mantras used in healing, which are also equally important till this point of my discussion with you, or the awareness of Ayurveda with you, was till the point of what we call as Jukti Vipashraya Chikilsa, which is like what we would describe as logical, sensible, scientific protocol related explanations of therapies. But the ones I'm going to speak you next would be Deva Vipashraya Chikilsa, that would involve processes of mantras being used, astrological considerations being used in healing, of energy healing in many cases where we do not find a tangible physical diagnosis always, or tangible etiologies of physical nature or verifiable nature, where we are forced to believe in things like possessions, in things like negative energies, in things like elementals, and things like black magic, which I never believed until I had my own first hand experiences for last close to 7 to 8 years with dealing with people from close to 80 different countries and various cultures in medicine and social domains. The reason I say is that I would conclude before I show the blood pictures to you as the last portion, is that there has been a lady somewhere from outside India, I don't tell the name of the country, but her complaint was sleeping with crocodiles. That was her dream every night. And in her case, the method that was done was pranic healing. I don't wish to elongate the process, what happened with her, but if I put it short enough, she stayed here only for 10 days, and I was very sure none of the nasyas, none of the shirodharas, none of the snehapanas would make her dreams go away. It was a method of pranic healing that was used in her, and we had a situation to realize that she had certain possessions that could be evacuated and expelled from her body and mind or spirit, whatever we call it, in her system, that made the healing for her. It's more than 4 years now. She doesn't have those symptoms of sleeping with crocodiles as her dreams. Also remember, somebody again from outside India, she had the problem of being unable to have sex with any man. The moment somebody would make the foreplay, she would feel extremely suffocated and she would say it's impossible. And that started after she became an adolescent, when she realized she was sexually abused by her own direct biological brother, a direct blood. And she was unable to make any proper coitus with anybody for that phobia and that suffocation inside her. Even in her case, she had tried her best medical care in Europe and also in US. She could not get any benefit. And like the previous lady mentioned, she also came just for 12 days to basically chill off here, as I would call it, because she just said, I know my condition is not curable by medicine. I'm just coming to India to relax. She too totally recovered from that, and she got into normal relationships and normal sexual life by the process of what was called the pranic healing that was done in her. And in these two cases, I personally did it. And ladies and gentlemen, when I say that there are some situations where the energy form of healings behave better than Ayurveda or maybe other systems of medicines they have already tried, I do not wish to put my sanity and my integrity into test. I really mean what I say, because that has been the experience with so many other people that I have come across so far, that there is a domain of healing that goes beyond the physical. All of us know that, but many of us usually hesitate to accept the same. And I make sure that it is conveyed to here, because many of you do carry, there's nothing personal, I don't mean to intend any specific person who is staying here. Many of you do carry problems that is not properly resolved or fully or satisfactorily resolved and cured in your home country. And that's precisely why you are here with us, and we are happy to help you. So if you ever think of the ideas of chanting specific mantras for your healing, of exploring the idea of energy healing, you are more than welcome to approach me, and I will guide you very precisely. And that would also involve the process of checking the chakras of the body, the energy chakras behavior pattern. And we have our own methods, which is not very easy to be explained in the normal so-called scientific, I put it like scientific in inverted commas, measures or the diagnostic technologies, but they're very relevant and very significant. So this is how we would deal with the healing of somebody. As you know very well, I am an academic trained doctor. I would prefer to speak only physical and speak and comment on those physical, verifiable, tangible parameters. But if I speak of these non-medical and non-physical measures, I have my own share of experience, which has already been described here. Any further details, of course, I am happy to share in person. but I thought it's important that I put such a domain possibility open to you for your consideration and maybe your correction if you wish so, but we are very sure of what we speak and say in these matters, because there are many equations and situations where the so-called doctors like me, or the allopaths, or the homeopaths, or even the Siddha or the Unani people fail, and people like the energy healers, like the clairvoyants and the psychics, do much better than we do. I won't say in every case, but there are many occasions like that. I'm not the only one to have such experiences. And we will conclude the last point by showing a few pictures which may be very objectable, or rather, sorry, objectionable for you. There is a reason why you are served different herbal waters here. There's a reason. In Ayurveda we call the blood impurities, and being a regular trainer of the Anushastras in Ayurveda, the parasurgical procedures, I have had the honor and the privilege to train more than 1520 doctors till date as of the 29th day of May, all over Kerala and even different parts of Kerala, even doctors outside Kerala, to realize different colors of bloods as we find, and which we easily attribute to blood impurity or rakta dushti, the terminology we use. Please don't be surprised to have different form of herbal water served here in the resort, because they clean the blood as we call it, and this is a simple indication of how you can see different forms of blood or different colors of blood. And they do have their clinic. This was somebody with gout and who had more yellowish tinge here. Different shades are basically different impurities of the blood, and this is Ayurvedic technical detail of blood impurity. As you can see, this was somebody with gout, and if you can see, this can be focused in the camera, this is like a coal tar by itself, and of course you see the fresh blood coming later. But let me be very clear with you that none of you would ever do the bloodletting therapy here without your informed consent, and the idea would be easily proposed to you very clear enough with the reasonings to it. If you can see, this is more black, and this is fresh red once the bloodletting procedure gets over. Just an indication how we never realize, this is also somebody's impure blood, because in Ayurveda bloodletting is considered to be half of the therapies and the remaining panchakarmas to be half. It is that powerful. A similar is the indication for the enema, according to a different medical school of Ayurveda, when the surgical school of Ayurveda of Lord, or rather the Acharya Sushrita would describe. So bloodletting is a very potent detox procedure. And here you see the balls, like, if you can call this a grathita, and this is worth focusing by the camera. Here it is a possibility. These are different kind of bloods we face when we do the process, and this is much more clear, and you can see the yellowish tinge here, and if you look into it, it's like a monk's blood. I have never seen anybody like that. Absolutely incredible, like a monk's blood. But my favorite is yet to come, and this is my favorite, 4 in 1. This is the 1, this is the 2, this is the 3, and this is the 4. I've never seen anybody, I have the video the same, 4 in 1 shade. Incredible. And she got profound relief after bloodletting. What I meant was that we do carry systemic toxicity in many ways, and this is one simple way of knowing through Ayurveda. There are many other methods though. So it's just an indication of how these blood impurities could be so much in our body in such a way that we may never realize it. So all these therapies are technically meant to clean the system as much we can. But I will reiterate again, this is not a standard everybody done procedure here. The indications decide the procedure of bloodletting. So by no means you need to be paranoid or uncomfortable thought of you being subject to the same. And if it happens, it's done through a proper understanding of the matter conveyed to you, and a proper guidance and a full informed consent prior to the procedure. I thank you very much for having a look at these things, so we could finally cover up a scenario where we had what I would describe as a clear understanding of these therapies. You would have your own share of videos being watched, in the panchakarmas of the herbal vomiting, herbal purgation, herbal enema, herbal nasya, the nasal medicament used, and everything would be shown very well to you. And please be keeping in your mind that I do all these therapies in an extreme manner. It's not very much necessary for you to follow the exact videos that are shown here, because it is not always important to follow the exact experience pattern that I go through, because all that matters is your social comfort also in the process, but at the same time keeping it as medically correct as possible. I'm sure you will feel much better. This video presentation of this PowerPoint I thought was more easier in this way, and you can have an easy look of it whenever you get time. It's just to give you some awareness of this topic of Ayurveda, because unfortunately most of the informations in Ayurveda in the internet is not clinically documented or clinical evidence based, and we definitely do not want our audiences to realize that Ayurveda is only a massage system as most people think it to be, or just a herbal system. It's a holistic approach. It's a totality of a science that takes care of the human life well before it is formed, from the point of having sex to make coitus enough for a child to be born to the point of the death of an old man. So it has the comprehensive coverage well before a life is formed till the life is over. And of course it has a very clear domain of preventive healthcare and curative healthcare, and it encompasses different aspects of the human health life. And that is why it is very important for us that we take a responsibility from our center of conveying, we won't say the most genuine presentation of Ayurveda on clinical evidence basis, but at least conveying a different approach or a different available approach than what is found in the internet about Ayurveda, because it's more than spa. It is a total healthcare system of medicine and life itself to it. Thank you very much.